Hello, everyone, and welcome back to Into the Ether, where we bridge the intersection of health, human behavior, and machine intelligence. I'm very excited today to be joined by a special guest. I'm here with Craig Selander, the VP of National Accounts at XP Health, which is an innovative digital care platform trying to invent how vision benefits work. Craig's a 20-year sales leader in employee benefits and digital health, and he's now at XP Health, who just recently closed a $33 million Series B funding and signed major partnerships with benefits platforms. Now, the interesting thing is that Craig joined 6 months ago, just after these big announcements, so it's safe to say that he came in to execute rather than to plan. Craig, welcome to the podcast. I guess, first of all, introduce yourself to the viewers and let us know what pulled you from digital health to vision care.
Yeah, hi Oliver. Great to be here on this important topic when we talk about employee benefits and really the innovation of where it's going. And as you start to think about, in my 20 years in business, I've seen just the evolution of different programs across the entire spectrum. And this is just, this is I think the seventh inning of a nine-inning baseball game, right? Where vision now is starting to get into the landscape in terms of how is that program delivering a lower total cost of care. And that's what led me to, the excitement of XP Health, what we're delivering in a market that really hasn't seen much innovation in the last 30 years.
When you say market, you're talking the optometry side, the vision side of it?
Yeah, I mean, vision benefits can mean a lot of things to a lot of different folks. But as we talk to the audience today that are HR benefits companies or benefits consultants, for that matter, it's really derived around the member that is trying to purchase eyewear, corrective eyewear. So think traditional glasses, but then also taking it one step further to, sunglasses. And as you know, with the amount of screen time that we do today, blue light glasses continue to be something that a lot of employees are looking for as well. And they want to have style and fashion. So they want to have choice. They don't want to be limited in terms of what they could wear when they're on screen.
And so you mentioned about the lacking innovation in the area for a long time. And obviously, you've been in employee benefits for 20 years. What would you say is the biggest thing you've seen that sort of stayed broken that entire time?
Yeah, Oliver, really when you start to think about vision, right? It's really I would say a program that's been delivered by a couple key major players, right? And when you start to think about those key major players for a second, they've done a fabulous job really integrating entire end-to-end process. However, what's kind of transformed through the end-to-end process is if you are the manufacturer of the frames, you own the brands, you own the actual, delivery of care, which would be the optometrist office. And then on top of it, you're the insurer. That's something to think about to go, wow, like, each and every one of those verticals has to make a dollar or two, right? They wouldn't be in business if they weren't delivering that. So what I've always kind of found unique through this, Oliver, is in no such vertical in any other perspective of healthcare delivery does one entity own the entire end-to-end process. You would never see, a medical facility own the doctors, own the insurance, own the products. You'd never see a pharmaceutical company own the manufacturing of the drug, own the actual facility that it's manufactured at, own the actual drug itself, own the doctors, and then lo and behold, be the insurer that is setting the price and the premiums for that entire end-to-end process. So when you start to think about vision for a second, I think today with a couple of the major leaders in the market, that's essentially that delivery model. And where XP has come into play is really to try to kind of drive in a position to say, hey, there's got to be a better way. One, how to enhance the technology? How do we bring more of that telemedicine into the actual landscape with vision, right? So more of a vision first, a virtual first approach that's coupled by bricks and mortar. And that's where we're having tremendous success thus far. In the few years that we've incorporated a network, we've got 3,000 plus clients and really are making a difference for that end-to-end member experience, coupling the flexibility, but then also the cost savings that's coupled in between that.
It's interesting because even just from like personal experience, I'd think about times when I would get an eye test or something like that, and it does seem kind of further behind than other health areas. So it's interesting that obviously that's something that is really going on.
Yeah, it is, Oliver, and I'll share a couple, comments around that. I would say first and foremost, vision uh, has historically just been a benefit that really sits at the end of value, right? It's been more of a low cost, low value benefit for many. As medical cost, typically that waterfall looks like this. You've got medical, highest cost. Then you start to look at like the dental, you start to look at life and disability, and then vision. But hands down, vision's always been a core benefit. I would say it's probably, if I was to shoot from the hip here, I would say it's probably in, 90, 95, 98% of employer groups benefit programs, because it's a definite need for, nearly 50 to 60% of the employee population. And when you start to think about not only eye care, but what is, the correlation between, individuals that are living with diabetes and hypertension, which we've seen, significant increase, in those conditions, those tie into eyewear as well, right? And
Interesting.
eye disease and so forth, because as you know, and the audience probably knows, there's a strong correlation between those chronic conditions and blood flow, which affects the capillaries, that affects potential eye disease.
Interesting. And so you mentioned about the digital first approach, and I'm really curious about in practice how this has helped. Obviously, you said eye care is already a part of majority of plans, employee benefits plans, but when it comes to actually employee uptake and things like this, how I know XP Health has implemented AI face scans. And that's something that's really interesting, and I'd love to know how the market's reacted to that.
Yeah, I would love to share a little bit more about that. But just to take one step back, I would say, again, in my 20 years in the business, I've seen the evolution of when health savings accounts hit the market, right? And there's an educational curve. People don't naturally adopt and change very quickly, and especially when you start to think about healthcare. So, health savings accounts was one example. Telemedicine, was another example, right? Where, the pandemic really stepped on the gas there. But it was a slow change, even though tremendous value, tremendous cost savings back to the consumer. It had been a little bit slower adoption rates. And I would say, what XP is delivering is really been the same thing, right? We're innovative in the space. We're delivering a program that really consumers haven't known an alternative path, right? It's either go to Walmart or Costco for, some low selection, kind of cheap, lower end grade glasses, or go to an optometrist's office with high end glasses where typically that member might be paying, four, five, 600% over what the actual cost of those goods would be to make. So, when you start to think about that for a second, it's really that evolution, right? And where we're at in that evolution, we think we're right on target, right? The consumers now are shopping more online with traditional daily habits. Oliver, I don't know if you're someone of you that shopped at Amazon before,
Of
but
course.
the experience, right? What's been your experience, Oliver, shopping at Amazon?
Well, it's just a bit too easy, too seamless. You just end up clicking and collecting, buying everything. Is kind of the way it goes nowadays.
Yeah, and you've got choice, right? You got choice at the end of the day, and no different when you're going through your eyeglasses. People want choice. So with XP, we'll have nearly 4,000 different frame choices as we launch 1/1/26. So, choice is very important to a lot of people. That same experience at Amazon is, you might be looking for, you know, whatever it might be, a hose to your grill. Well, there's all different types of hoses, right? That otherwise, if you went to a big box retailer today, you might have one choice at Home Depot. So members want choice, right? Employer groups want to give their members choice. And especially when you start thinking about that for a second, something that you wear on your face, such as, I wear eyeglasses, it's personal to a lot of people, right? They want design, they want choice, they want personalization. And that's what XP is delivering in the marketplace. Taking
Okay.
that one step further, just to circle back to the technology side of things, Oliver, and how XP is delivering kind of that augmented AI experience. Some of the the podcast members listening today might wonder, well, how do you do that? How is XP doing that? And actually, we created a proprietary technology that measures 450 data points with our artificial intelligence. It's measuring pupillary distance, right? It's measuring the size of the face, the width, the longitude of the face, etc. And essentially, it's making then a recommendation and bringing that personalization to the fold. So unlike in a traditional model today where there may be, an optometrist that does fantastic work, that's just one person's opinion actually saying, "Hey, guess what, Oliver? You look fantastic in those glasses. They look to fit you perfect." And that's just an opinion, right? We're utilizing the data and the science behind actually the measurement and the recommendations. And then our tool and our marketplace is curating different options to essentially put in front of that member. So now they're actually getting multiple choice recommendations. We're using some of the data science and artificial intelligence to make sure it's the best fit for that specific member. And then at the end of the day, the great news is that member gets to make that choice of, hey, I love that. I love the fit, and away that they go. So really kind of taking that one step further in that process and using, the technology that can be delivered that is really just enhancing that overall member experience.
Yeah, that's incredible because I can imagine how, the lack of choice is one of the biggest pain points for someone when it comes to choosing that kind of thing. As you said, it's actually, I mean, it's something you wear every day, right? So I guess it matters more to the customer than people might assume. So yeah, I can see how that's really beneficial. So when it comes to, obviously, as we mentioned in the intro, you joined 6 months ago or so after I believe that they made a couple of big partnerships with Ameriflex, if I'm not wrong. How's that been working out? And I guess is that kind of how you see the adoption of this happening through more partnerships, or is there also a big market for this outside of employee benefit schemes?
Yeah, I'm glad you asked that question. And again, as you start to think about, the go to market, right? We're an innovator in the space. It's not easy to break in, especially when, you have a couple large entities that kind of control the market, right? So how do you break into the market, right? How do you break that status quo? And there's really a few different ways to do that. And the good news is that the paths have been blazed before, right? When you start to think about some of the, more recent organizations, such as like an Omada Health, right? My former employer that I worked with. Think of like a Hinge Health, right? Or a Sword that's in the musculoskeletal market that's really been game changers, right? Some of those paths, Oliver, have really been blazed. And you really have to start by getting some flagship groups, right? Some prominent groups, large employer groups that have bought in and they're just tired of living in that same status quo. And they know there's a better way for them to procure their benefits, whether it's for those programs that are delivering a lower cost of care or whether it's for vision. And coming back to the partnership side of things, we're very pleased in the progress that we're making with some of those partnerships as well, right? And we're not stopping, with one or two. We would love to, bring that to the broader landscape. And essentially, it just allows us sometimes the easy button, just due to the nature of if you're working with a TP or a health plan, they are already partnered with the client. And when you can have that plug and play model, essentially it just can make things sometimes easier for that large employer group from either like a billing perspective, an enrollment perspective, and an engagement perspective. There's a multitude of ways that really kind of enhance that. So hands down, yes, a very, very important path that's not lost on us from a partnership perspective, but also for those employer groups, again, that are on the cutting edge. They don't want to wait for those partnerships and they want to move today because they know that their members have the opportunity to be delivered an enhanced vision benefit along.
And when it comes to that decision making process, what would you say has been the biggest bottleneck for you? Would it be like market education around, the importance of this kind of service, or is it like, what would you say is the biggest bottleneck when it comes to that?
Yeah, I mean, again, the question you had earlier that I shared is people are reluctant to change, right? And especially when it comes to healthcare. And I would say sometimes the mentality is if it's not broken, we don't need to fix it. So there
Mm,
might be low noise tied around vision, right? And I often try to tell this story as I'm meeting with, some of the largest consulting firms, in the country is, as you start to think about for a second, there was nothing wrong with Target. People weren't really complaining about Target and what their process was. You got in your car, you'd go to Target, you'd make your purchase. They had a lot of choice. It was pretty reasonably priced, clean stores. Overall, it was a pretty darn good experience, right? And then along came Amazon. And people didn't jump into Amazon right away, but as the word of mouth started and as Amazon evolved and they made it a much easier buying experience, most people in America probably have tried purchasing through Amazon. And the simplicity, the ease, the cost, the choice, all those things have lined up that now, today, frankly, my wife buys everything on Amazon. She buys, my kids' lunch goodies. She's buying different types of household items that we used to always buy at Target, right? So there's that paradigm shift that you go through. The same thing, another example I try to bring to light is taxis, right? There's no real problem with taxis before. You could usually get a taxi when you wanted. You could call in advance. You could schedule the taxi. And then lo and behold, guess what showed up? Uber, Lyft. And now I have this in the palm of my hand. I can schedule it. I'm seeing where where that Uber driver is, how long the time is. And more times than not, it was actually more cost effective. So, the status quo as healthcare needs to have adoption and change to lower the total cost of care. Members are demanding and want a better experience. It's really breaking it down to some of the decision makers at the employer side of things, and then also benefits consultants to say, hey, even though we're hearing low noise, how do we bring an enhanced benefit to our employee members? Because there are better ways out there to deliver this benefit, such as vision, to the employee population. And that's exactly what XP is delivering upon, is that member experience, reduce cost savings, and bringing it in a virtual platform that, the market is asking for today, as proof is in the pudding, with other types of virtual delivery programs and consumer goods that are being purchased.
absolutely, yeah. Yeah, I think like it sounds to me like it's really at sort of a pinnacle point in terms of market awareness, and once people experience that kind of improved experience in eye care through the digital platform, it's obviously just going to accelerate from there. So I guess where do you see things going in the next 2 years for XP Health, and like what would make this 2025 the best year yet? I suppose things sound like it's pivotal moments. So,
Yeah, no doubt, Oliver. As you start to think about the future again, it's really getting our distribution partners to see the value prop, right? And really to go through the experience. We'll offer actually, a member experience where, excuse my dog's barking here.
yeah, no worries.
Sorry about that. I would say, to really step on the gas is to continue to get, those innovators in the space on board, right? The trajectory, again, as long as I've been in the space, you have the early adopters, right? And then you have your middle wave of employer groups or consultants that start seeing that they come into play. And then you have your laggers in the market, right? And that's really how that paradigm, transforms. So I would say we're in that early adopter phase. And as we move into 25 and then into 26, I would say, excuse me, I would say the next wave of buyers would start to actually bring XP to their clients and really show, what type of value could be delivered.
And in terms of expansion, is this something down the line looking to go global with the platform, or currently just looking at the US market?
Yeah, I mean, today we're in the U.S. market. Is there potential? Nothing is out of scope, I would say, but we need to continue to evolve in the U.S. market, continue to bring more value to the U.S. market, continue to establish, like I said, the partnerships through health plans, through TPAs, alternative distribution channels, et cetera, to really start to grow the market landscape. And then who knows where we can go from there.
It's exciting stuff. It's exciting stuff. I wanted to touch a little bit. You mentioned about your experience at Omada Health. I wanted to touch just a little bit on that and how that experience with personalized care teams shapes what you're doing today, as well as your previous roles in the past.
Yeah, great question. So already, as you think about, Omada, I was very fortunate to work with a very progressive company that was solving for, chronic condition management, diabetes, hypertension, prediabetes, and musculoskeletal. And, I don't know if you saw the latest news, but they just did go IPO a couple weeks ago. So congratulations to Sean Duffy and team for that excitement. I was very pleased to be part of that organization to move them along the way to get them to that point. So when you think about a personalized care team, right, it's really taking that to the next level, and that's something that I would say Omada really did a very strong job at. It just wasn't just a pure virtual solution. They augmented that with a human and personal element. And it's something that I believed in their mission from the very beginning in terms of, what they were doing and how they were doing it. Because face it, healthcare it's personal, it's emotional. And having that additional support it's really a key component to delivering on the end goal is, how do you enhance the care delivery for that specific member living with that chronic condition? And how do you deliver a lower cost of care, at the same time, right? And when those two stories come together, typically you're going to see a very positive result at the end of the day. So, Omada's done a great job in doing that. They've executed along the way. They've done a great job in terms of partnering with PBMs. In the last, call it 2 years, they've evolved very significantly in the GLP-1 arena as well, as that became a very hot topic of how do you actually support the member through that process. That's, going on a GLP-1, that's going to be losing X percent of body weight in a very rapid fashion, and how they lose the weight, and how do you bring that behavior modification, into the fold as well. So very unique. Now the synergies, as you start to think about, what Omada had done and what XP is doing, very similar in nature. Omada's been around for, I believe they're probably coming up on their 13th or 14th year in business. So we're right in line with where Omada was, at their stage, looking back. So pretty interesting just to kind of see how those parallel paths are kind of are
Yeah, I can imagine sort of the integration of the physical aspect, going to appointments, seeing someone in person, as well as using digital technology as much as possible. It's getting the balance there seems to be more really pressing issue nowadays. And I suppose I see how, I mean, I'd be interested how XP Health is really, also adding an element of success to the in-person part of the experience and how it's sort of not over digitalizing itself to make sure that people still feel that personal connection, that emotional connection that you mentioned.
Yeah, for sure. So, when you start to think about health tech and similar to what Omada did is, there has to be that component, right? And with XP, about 2 years ago, we launched network, so then we could bring the best of both worlds into the fold. So we have the ability to still bring a traditional network with national vision administrators, which has about 99,000 access points across all 50 states. So we have the ability to still incorporate that human element as part of the buying process, right? So members still can go in for an eye exam. When you start to think about the actual clinical standards of care, we base all of our clinical standards of care off of the American Academy of Ophthalmology. So when you incorporate that into the fold, they state that you should have an eye exam every 2 years between ages 18 to age 55, unless you are living with some type of condition, right? So the fact of the matter is, You don't necessarily need to go in on an annual basis for an eye exam. However, I would say, that's where the market has more or less kind of tried to deliver the message, right? And for various reasons behind that. Again, if you come back to how I started the conversation, when you have a full integrated model, the only way those fully integrated models are going to continue to drive revenue is by getting people into that storefront. Where XP doesn't necessarily live in that same environment, um, and stands behind more the clinical standards of care, right? That the American Academy of Ophthalmology, stands behind, and has created. Within that, we still augment, the bricks and mortar location with the virtual to bring that to life for that member. So if they do need to go in for a physical exam, they would go into the National Vision Administrators Network. And then from that point, they get their eye exam. They can capture their actual prescription. They then would come to the XP marketplace and do all their shopping and essentially purchase the actual eyewear through the XP marketplace at that wholesale
Right.
price. That can range anywhere from 200 to 800% in reduced cost savings for that specific.
Right, amazing. So yeah, I mean, it really is like innovation that's putting consumers first, and I think that's what the market's looking for. And yeah, it's impressive. I mean, I saw your LinkedIn. It said that's what you're driven by, innovation that puts consumers at the forefront. And yeah, it's nice to see that that's really is what's happening. I guess where does that come from for you? Was that a career long thing? Was that kind of a realization for you over the years, or has that always been like a real driving factor for you?
Oliver, when I entered the business, I was always fascinated with the innovation of healthcare, right? And it was always pretty personal to me as well. I had a personal experience where my father had a heart attack and passed unexpectedly. He was a school teacher for 36 years in the same classroom, and what I didn't know was that there was no life insurance. And it was a pretty eye-opening experience for me as a 30-year-old to say, well, my father didn't have any life insurance. He always had life insurance through his employer, through the school district where he worked at. And that was a pretty eye opening experience for me. And really, since then, even though life insurance has parlayed its way into health, for me personally, it was always about, how could I make a difference in someone's life, right? Just due to, my personal experience. So as I've entered the landscape, I've worked at numerous outstanding organizations for numerous outstanding leaders, Blue Cross Blue Shield health plans. I worked in the analytics space with IBM Watson Health. I mentioned Omada previously. And as you start to think about my personal 20 years, it's always been, what's been at the cutting edge, right? And how can I bring advancements, into the arena of healthcare, or really, cost containment around how healthcare is delivered, right? And through that process, I've really just been fortunate to work with numerous consultants and large employer groups ranging from, 30 employees up to, 100,000 employer size groups. And it was very personal to me, through my evolution of when I see something that I really believe in that could make a difference, I wanted to tap my network and my trusted network to really make an impact and say, hey, I vetted this personally. I think it can make a difference. And it can really make a difference both from a clinical perspective and from a cost savings perspective. And if you were to take that one step further into like the experience and so forth, something you maybe have heard of like triple aim, that's more or less an industry term to say all those components are coming together, putting the member at the center of care, but the complementary measures going back to the employer that might be funding those specific programs. And throughout my career, that's, if you start to look at it, it's really kind of revolved around a 3 to 5 year process. I've been in an organization, we've delivered it, we've brought value to numerous clients. The next evolution has stepped up and so forth. and I've jumped on that to bring that to the market as well. So I can't say I'm always the one doing the innovation or creating the innovation. I take great pride in bringing the innovation to market.
Well, that's the most important part, isn't it? But yeah, Craig, this has been really insightful. It's interesting to see you're basically building the future of vision care in real time. And for people who might be in similar spots, scaling innovative health tech, what's one thing you would tell them?
There's a lot of there's a lot of vendors out there, that are trying to do, the right thing, right? And the one thing that I would probably always advise is, um, work with a partner that has some testimonials, right? Work with a partner, and take a leap of faith, right? When you look at the data and what they've been able to deliver. And don't be scared of change, right? That's probably the last thing I would say is, don't be scared of change, because change can be scary. But if we don't change, look where the healthcare system has come in 20 years, right? I mean, game-changing drugs, right? We've got weight loss drugs now that are, impacting people's body mass by 20%. Yes, they're costly, but they're definitely impacting individuals' lives. So without those advancements, if you're not willing to change, it really, will put stress on the organization, will put stress on the member population because of what they're living with today, right? And that's either, a poor member experience. They might not be getting the actual cost of goods at the appropriate price that they could be, and that end-to-end value that employers, why they offer benefits. Don't lose that thought of mind, right? Of why are we delivering benefits if it's not going to be the best in class in the market, right? And truly try to recruit and retain, members that are doing great work for those employer groups.
Yeah, changes everything. Changes definitely everything. Where should people connect with you if they want to follow what you're building?
I would welcome people to pick up the phone, connect with me, check out our website, xphealth.com, or you can definitely reach me directly at Craig, Craig, at xphealth.co, and that's .co. Or I'll even give my phone number, 651-334-7112. I welcome you to connect with me on LinkedIn. So you're just getting always the latest and greatest as the market continues to evolve. XP continues to evolve as well. And just love to support any and all initiatives that are advancing healthcare and delivering a lower cost of care for employees and employer groups.
Amazing. Yeah, definitely an exciting time to be in the space. Craig, thank you so much.
Thank you,
So, yeah,
Oliver, for the opportunity, and rooting everybody on for lowering that total cost of care and employers. So have a great one and talk soon.
goodbye, everyone.